Cystic fibrosis has taken a fair toll on me. I really became aware that my condition was worsening when I was carrying a laundry basket up from the bottom floor of the house. And of course, I was attached to my long 60-foot oxygen tube, and I walked up the first couple of steps. And I had to sit down. And I thought, well, I've got to get this laundry up, and so I walked up a few more steps, and the same thing happened. And then the next time, I made it a few more steps. My legs gave out under me, and the laundry basket toppled out of my arms, and all the dirty clothes from it just spewed down the stairs. And at that moment, looking at it, it was like those dirty clothes were my life, that my life was just falling apart. I just sat on those stairs and I bawled like a baby because I knew that the end was coming, and short of a transplant, there was nothing I can do about it. I didn't consider any other route other than when my lungs start to fail that I wanted a lung transplant. I was not a person who would allow cystic fibrosis to take me easily. I went down to Duke for a checkup. My transplant pulmonologist looked at me and she said, if you don't relocate in the next week or two and get listed, you are going to die. Duke does such a high volume of transplants and has such a skilled and well-known team. And they're one of the few places that do pre- and post-transplant rehab, which I considered absolutely critical. Duke was the obvious choice by far. The first time around, I waited only 12 days because I was fairly unstable and could have really crashed at any time. The second time around for my retransplant, I wasn't as critical, and so I waited 6 weeks. I felt so happy, yeah, because I knew my life was going to change. And I'm actually shaking now a little bit remembering it because it was such a wonderful moment, such a moment of joy for me. For someone who's had trouble breathing, those first breaths are amazing, but they're also incredibly strange. It really took several weeks before the muscles in the brain started coordinating, and up to about 6 months before my diaphragm fully recovered. After transplant, especially after my second transplant, I was able to go on a hike 2 weeks after the surgery. 3 months after the surgery, I did a 60-mile forced march in a day and a half. 6 months after the surgery, I was able to do a 26.2-mile marathon carrying a 20-pound pack. Really, it feels like the sky's the limit sometimes. I have my life back. So when you have a transplant, yes, you're giving up your old lung condition, but you're taking on a whole new host of issues. The regular immunosuppressive transplant medications have a lot of side effects. In my opinion, the benefit so far outweighs the cost. When these lungs eventually fail, there is no question that I would want a third if I am eligible. The team at Duke, they see people as individuals. I mean, they're not just treating a set of lungs, they're treating the whole person. It's so obvious that everyone cares about the patients and about restoring people's lives through the amazing process of transplant. I'm just so excited to have the opportunity to watch my children grow up, possibly seeing them get married and grandchildren. I mean, that would be a dream come true. It's my life and I love it. And yes, it's had a lot of ups and downs, but I don't think there's much I would change about it. Each new experience, whether it's good or bad, it teaches you something for whatever comes next.